Good morning. Am I audible?
Yes, ma'am.
Okay.
Hello.
So yesterday we started with eczema. So what is eczema? Also called as dermatitis. And it is non-contagious inflammation of the skin characterized by erythema, scaling, edema, vesiculation, and oozing. This is the natural history of eczema. That is, starts with erythema, then papules with edema, then vesicles, then weeping, crusting, pustule formations, then scaling. Now all this process leads to lichenification and at last healthy skin without scars. Then we have seen about morphology, acute phase. In acute phase, there is a erythema, edema, vesiculation, oozing and crusting. In subacute phase, it is erythematous, hyperpigmented plaques with scaling and crusting. In chronic phase, there is a lichenification, a combination of thickening, hyperpigmentation and prominent skin markings. What is lichenification? It is a combination of thickening, hyperpigmentation and prominent skin markings. What are the typical sites of eczema? So these are face, on face especially hairline markings, eyelids, lips, neck, elbows, wrist, groin region, knee folds, and ankles. These are the common sites for eczema. Etiological classification. First is exogenous, that is, the cause is outside the body. That is irritant contact dermatitis and contact allergic dermatitis. Second one is endogenous, that is, cause is within. That is atopic, seborrheic, Aetiological or xerotic, gravitational or stasis, POMPHOLYX, dyshydrotic, localized neurodermatitis, and last one is combined. That is both causes, exogenous as well as endogenous. For example, nummular or discoid dermatitis. We have seen about treatment of eczema, basic treatment, that is medication, corticosteroid, glucosteroids, prednisolone, immunomodulators to suppress the immune system, antibiotics, immunosuppressants, for example, cyclosporin, an anti-itch drug, like antihistamines. Then avoid the dry skin. Then diet and nutrition. Mainly the dietary elements that have been reported to trigger eczema includes dairy products, coffee, soybean, eggs, nuts, wheat and maize. All these things trigger the eczema. Then behavioral approach. Patients undergo a 6 weeks monitored program involving scratch habit reversal and self-awareness of scratching levels. So these are basic treatment. Then we had also seen about types. First type is atopic eczema, also called as infantile eczema, flexural eczema, atopic dermatitis. Believed to have hereditary component. Often runs in families whose members have conjunctivitis, hay fever, asthma, that is allergic problems. Itchy rash is particularly noticeable on head and scalp, neck, inside the elbows, behind knees, that is flexural surfaces of joints, and buttocks. Etiology, first one is allergy. So it is primarily aggravated by contact with or intake of allergens. And atopic eczema consists of chronic inflammation, and it often occurs in people with history of allergy disorders such as asthma and hay fever. It can also influence by hidden factors such as stress or fatigue. Environmental factors, nutrition and hygiene also play a role in susceptibility. Then we have seen about pathogenesis, that is interplay of genetic susceptibility leads to epidermal barrier dysfunction, leads to abnormal immune response, and finally there is presentation of atopic dermatitis. In clinical features, in infantile phase, the morphological features of acute and subacute eczema are observed over the face and extremities of an infant. And on the face, they have an extra fold beneath the eye, which are called as Denny Morgan folds. You can see atopic eczema. Then childhood phase. In childhood phase, there are excoriated papules and features of subacute eczema over extensors and flexures of extremity. And this stage is up to age of 10 years. Then adolescent phase and adulthood phase. Here there are features of chronic eczema, mainly lichenification, and it is on the flexures of the extremities. This is the image, atopic subacute eczema on fronts of the ankle of teenager. This is atopic dermatitis with hyperpigmentation, lichenification, and scaling in the antecubital fossa. And complications. First one is skin infections like impetigo contagiosa, cellulitis, mollusca contagiosa, viral warts. Then irritant reaction due to defective barrier function, poor growth due to chronic disease and sleep disturbances, immediate urticarial reaction due to food allergy, psychological factors for patient and their family. So these are the complications. And how to diagnose? First one is present or past personal or family history of atopy, presence of severe pruritus, persistent or relapsing eczema. Minor markers are hyperlinear palmar fields, pityriasis alba, extra infraorbital fold, spring catarrh, keratoconus or anterior subscapular cataract. In prevention, diet, avoid the allergens. So identify the food items. In infants, breastfeeding is the best way to avoid these problems. Then environment and lifestyle. So adults should avoid smoking. Then anger, stress, and lack of sleep are also factors that are known to aggravate eczema. So control it. Then excessive heat and coldness are known to provoke outbreaks. Then therapy, promote the use of bland and soothing creams. Minimize the exposure to soap and other chemicals, synthetic and woolen clothes, and too hot or too cold environment. Then in infantile eczema, there are some types like atopic dermatitis, seborrheic dermatitis, xerotic eczema, napkin dermatitis, contact allergic dermatitis, secondary eczematization, that is eczematous change as a complication of scabies. So second one is contact dermatitis. Contact dermatitis is a term of skin reaction resulting from exposure to allergen or irritant. Phototoxic dermatitis occurs when allergen or irritant is activated by sunlight. Types of contact dermatitis, that is allergic contact dermatitis and irritant contact dermatitis, which is allergic resulting from delayed reaction to some allergens such as poison ivy or nickel, and irritant resulting from direct reaction to solvent. Example, sodium lauryl sulfate, harsh soaps, detergents, cleaning products. It is most common occupational skin disease. Contact dermatitis is a localized rash or irritation of the skin caused by contact with foreign substance. Inflammation of affected tissue is present in the epidermis and outer dermis. Then how to differentiate it with contact urticaria? In contact urticaria, rash appears within minutes of exposure and fades away within minutes to hours. But in contact dermatitis, it takes days to fade away. Clinical feature, red rash. The rash appears immediately in irritant contact dermatitis, and in allergic contact dermatitis, the rash sometimes does not appear until 24 to 72 hours after exposure. Then blisters or wheals formation, itchy and burning skin. See the images. And diagnosis, patch testing. A measured amount and concentration of suspected allergen is applied under the occlusion to the patient's back, and the reaction read after 48 hours. The positive test shows edematous papules or vesicles. Treatment is self-care at home. That is, immediately after exposure to known allergen or irritant, wash it with soap and cool water to remove or inactive most of offending substances. Weak acid solutions, that is lemon juice or vinegar, can be used to counteract the effect of dermatitis, which is counteracted by exposure to basic irritants. Then we have seen about seborrheic dermatitis, a form of eczema which is closely related to dandruff, also called as cradle cap in infants. And it is endogenous type of eczema. Area is scalp and face. Etiology, mainly the etiology is unknown, but it can be due to yeast, Malassezia furfur. It can be due to genetic, environmental, hormonal, immune system factors. In children, it may be due to excessive vitamin A intake, and it may be due to lack of biotin, pyridoxine, and riboflavin. It is associated with hair loss. It may be temporary, or in severe outbreaks, it can be a permanent hair loss. See the images of seborrheic dermatitis. In differential diagnosis, in groin area, flexural psoriasis affect other areas. Ringworm infection, that is tinea pluris, which is not symmetrical. Intertrigo, which is symmetrical. Clothing dermatitis affects other areas also. Chronic benign familial pemphigus, it has family history. The next type is nummular eczema or discoid eczema. Nummular, that is coin-shaped. Coin-shaped areas of acute or subacute eczema over extensor of extremities, especially dorsal of fingers, hands and feet. It is combined type, that is endogenous and exogenous. This is the image of discoid or nummular eczema. See the coin-shaped lesions. Then xerotic eczema, the name itself suggests dry skin. Its other names are osteotic, eczema craquelé, eczema craculatum, winter itch, pruritus himalis. So it is the dry skin that becomes so serious, it turns into the eczema. And it worsens in dry winter weather. Limbs and trunks are most affected. Cheeks and sides of the face are commonly involved in children. So these are the images. In therapy, avoidance of soap or sparing use of mild soap. Frequent application of cold cream or vanishing cream. Correction of predisposing factors. The next type is lichen simplex chronicus, that is circumscribed neurodermatitis. This is the result of persistent rubbing, scratching of an area of the skin. Initiating cause of pruritus. It may be chemical or mechanical irritation, allergic contact dermatitis, atopy or habitic, that is neurodermatitis. Cause can be anything, the cycle will be same, that is itch, scratch, itch. Morphology, fairly well-defined patch, hyperpigmented plaques with prominence of normal crisscross grain markings. Thickened skin show tiny crusts or erosions because of scratching. Areas are mainly dorsal of feet, ankles, wrist, extensor of forearm. The next type is venous eczema or stasis eczema. It is developed on the lower extremity, secondary to venous incompetence or chronic edema. Venous eczema or stasis eczema, it develops on the lower extremities, secondary to venous incompetence and chronic edema. The early findings consist of mild erythema and scaling associated with pruritus. The typical initial site of involvement is medial aspect of ankle, often over a distended vein. Stasis dermatitis is often complicated by secondary infection and contact dermatitis. And severe stasis dermatitis may precede the development of stasis ulcer. So venous eczema or stasis eczema, it develops on the lower extremities, secondary to venous incompetence and chronic edema. Early findings consist of mild erythema and scaling, which is associated with pruritus. Its main site is medial aspect of ankle, and it is often complicated by secondary infection and contact dermatitis. And the severe stasis dermatitis can lead to development of stasis ulcer. See the image, venous eczema or stasis eczema. Treatment: patient with stasis dermatitis and stasis ulceration benefit greatly from leg elevation. The routine use of compression stockings. Protecting the legs from injury, including scratching. Control of chronic edema to prevent ulcers. So treatment includes leg elevation, compression stockings, protecting the leg from injury, including scratching, and control of chronic edema. So see the image, the stasis dermatitis showing erythematous, scaly and oozing patches over the lower leg, and several stasis ulcers also seen in this patient. You can see these ulcers. The next type is napkin dermatitis. So it is mainly common in infants. There is a persistent contact with urine and feces, which causes damage to the skin and alter the normal flora. And ureolytic bacteria from feces acts on urine, leads to release of ammonia and leads to irritation of skin. Its clinical features are erythema, edema, erosions of counters of buttocks and inner thighs, sparing flagels. Therapies: keep the baby dry, use soothing and protective creams like zinc creams, and mild topical steroids like hydrocortisone. See the image, napkin dermatitis. The next type is photosensitive dermatitis, a state of heightened sensitivity of the skin to ultraviolet and visible spectrum of light. It is seen mainly in adults. Photosensitive dermatitis, it is a state of heightened sensitivity of the skin to the ultraviolet and visible spectrum of light. It is seen mainly in adults. Distribution: sun exposed areas, face, ears, V area of chest, back of the neck, forearms, and dorso of hands. These are the areas which are exposed to sun. See the images, photosensitive dermatitis. Next type is POMPHOLYX or dyshydrotic dermatitis. Dyshydrotic dermatitis is a skin condition that is characterized by small blisters on the hands or feet. Dyshydrotic dermatitis is a condition that is characterized by small blisters on the hands and feet. It is an acute, chronic, or recurrent dermatosis of the fingers, palms, and soles. Clinical features: a sudden onset of many deep-seated pruritic, clear vesicles. Later there is a scaling, fissure formation, and lichenification. Sudden onset of many deep-seated pruritic clear vesicles. In later stage, there is a scaling, fissures, and lichenification. The name comes from the word dyshydrotic, meaning bad sweating. Dyshydrotic meaning is bad sweating, which was once believed to be a cause, but this association is unproven. And there are many cases present that with no history of excessive sweating. There are a number of different factors which may trigger the outbreak of dyshydrosis, such as allergens, stress, or seasonal changes. Emotional stress may also further aggravate the condition. See the images, POMPHOLYX or dyshydrotic eczema. This is the advanced stage of dyshydrosis on the palm, showing the cracked and peeling skin. And second one, advanced stage of dyshydrosis on the foot and sole. Then treatment, salt soaks, that is maintaining palms for 40 minutes to an hour immersed in a salt solution of 1/4 salt dissolved in water. Treatment is salt soaks, that is maintaining palms for 40 minutes to an hour immersed in a salt solution of 1/4 salt dissolved in water. Repeating the treatment for 3 to 4 days or additionally if required. It is best to soak only the palms and avoid exposing the top of the hands to the saline solution, as salt can severely dry and irritate the skin on the top of the hand. Or we can use white vinegar soaks also. And therapeutics. So according to histopathology, in acute stage of edema of epidermis, which progresses to form intraepidermal vesicles, which enlarge and rupture. So it covers psora myza. So in acute stage, edema of epidermis, which progresses to form intraepidermal vesicles, which enlarge and rupture. So this stage is psora stage. Then second, in chronic stage, there is a less edema and vesiculation, but more thickening of epidermis, that is acanthosis, and it is accompanied by variable degree of vasodilatation and T helper lymphocytic infiltration in dermis. So this one is psychosis stage. So on the basis of histopathology, in psora, it mainly covers the acute stage where edema of epidermis progresses to form intraepidermal vesicles, which enlarge and rupture. And in psychosis, that is mainly in chronic stage, where there is no edema and vesiculation, but more thickening of epidermis, which is called as acanthosis, and it is accompanied by variable degree of vasodilatation and T helper lymphocytic infiltration in the dermis layer. Then according to clinical features, same. SORA covers the acute phase, acute eczema. Symptoms are redness, swelling, papules or vesicles, exudation and cracking, scaling. So SORA includes acute phase of eczema, that is acute eczema with redness, swelling, papules or vesicles, exudation and cracking, and scaling. And combination of SORA psychosis or SORA to psychosis, it covers chronic eczema, which is less vesicular, exudative, with lichenification, fissures and scratch marks, and pigmentation. Chronic eczema, miasm is SORA to psychosis or SORA psychosis. It is less vesicular, exudative, with lichenification, fissures and scratch marks, and pigmentation. Meeting will end in less than 1 minute, so you can rejoin again. Then we see about specific remedies. The first one is Arsenicum album. So some specific remedies. First one is arsenic album. So arsenic album, there is eczema with burning and restlessness, eruptions upon face and scalp, that is dry and scaly, pimples and vesicles upon the face with acrid, even fetid discharge with intense burning and itching. Eruptions appear upon the legs and genitals. Eruptions are dry, scaling of a bran-like purpurinaceous character, especially about the forehead and margins of the hairs. Itching, burning and swelling, which is aggravated from cold and scratching, better from heat and warm drinks. Seen in children who are debilitated and anemic. So in arsenic album, there is eczema with burning and restlessness, eruptions upon face and scalp that are dry and scaly, pimples and vesicles upon the face with acrid, even fetid discharge with intense burning and itching. Eruptions appears upon legs and genitals. Eruptions with dry scaling, especially on forehead and margins of the hair. There is itching, burning, and swelling, which is aggravated by cold and scratching, and better by heat and warm drinks. And it is seen in children who are debilitated and anemic. Next is Calcarea calv. Children, especially lymphatic subjects with large heads, blue eyes and light hair. Eruptions are dry but thick with bland pus which forms the crust. Children with chronic sore eyes, otitic discharges and generally unhealthy skin. So Calcarea calv, children, especially lymphatic subjects with large heads, blue eyes, light hairs. Eruptions are dry, thick, with bland pus, which forms the crust. Children with chronic sore eyes, otitic discharges, and generally unhealthy skin. Next one is sepia. Eczema occurs about the bends of the joints and behind the ears. Specific location. Eczema occurs about the bends of the joints and behind the ears. For subjects of humid eczema with vesicles on the red base on different parts of the body with intense pruritus. The eruption is at first dry but soon becomes moist and discharges copiously. The skin becomes dry, cracked and exfoliated. It also covers the eczema of genitals. The next and mostly used remedy, sulphur. Eczema with intense burning and itching. Aggravation by washing, scratching, dry offensive, scabby, easily bleeding eruptions. Eczema about the margins of the hair, especially on the neck. Children whose skin is unhealthy, who are marasmatic, in whom dry eczema occur with enlargement of glands under the yellow crust, seen more especially about the chin, neck, fingers and toes. Eczema caused due to hair dyes, aggravation from heat of the bed, covers and pillows. In sulfur, eczema with intense burning and itching, aggravation by washing or scratching, dry, offensive, scabby, easily bleeding eruptions, eczema about the margins of the hair, especially on the neck, children whose skin is unhealthy, who are melasmatic, in whom dry eczema occur with enlargement of glands, with yellow crust, thin walls, especially about the chin, neck, fingers and toes, eczema caused due to hair dyes, with aggravation from heat of bed, covers and pillows. Next one is graphitis. Eczema in blonde, fat children who are subjects of sore eyes, eczema of the hands, face, lips, scalp, and behind the ears. Moisture forms in the thick yellow crust. It is not painful, but eczematous spot, itch and burn. Weeping eczema. The discharge is sticky, honey-like fluid which comes out on scratching. So the discharge is sticky and viscid, which is aggravated by warmth and at night. So in graphitis, eczema in blonde, fat children who are subjects of sore eyes, eczema of the hands, face, lips, scalp and behind the ears. Moisture forms in thick yellow crust. It is not painful, but the eczematous spots itch and burn. Eczema is weeping. Sticky, honey-like fluid comes out on scratching. The discharge is sticky and viscid. Aggravation by warmth and at night. The next one is rustox. Dry eczema with redness and swelling. Intolerable itching and burning, which is aggravated by warmth. Eczema on scalp in infants. Eruptions more or less vesicular with thin, watery, dark-colored, offensive secretions which comes from scales, and vesicles inclined to suppurate. So in rustox, dry eczema with redness and swelling, intolerable itching and burning, which is aggravated by warmth, eczema on the scalp in infants. Eruptions are more or less vesicular with thin, watery, dark-colored, offensive secretions. Vesicles inclined to suppurate. Next remedy is MEZERIUM. So in MEZERIUM, there is an intolerable itching which is aggravated in bed and from touch. Copious serous exudations. The head is covered with thick leather-like crust under which thick and white pus collects. Hair are glued and matted together. Pus becomes offensive after a time and breeds vermin. Eczema on hairy parts. So in MEZERIUM, there is an intolerable itching which is aggravated in bed and from touch. Copious serous exudations. The head is covered with thick leather-like crust, under which thick and white pus collects. Hairs are glued and matted together. This pus becomes offensive after a time and it breeds vermin. Eczema on hairy parts. The next one is petroleum. In petroleum, there is a yellowish green thick crust on the face and neck which discharges profusely. It cures eczema with bloody cracks but little or no discharge. Eczema is dry and scaly or moist, disappearing in summer and reappearing in winter or cold weather. Eczema and fissures occurring on hands or on behind the ears. The discharges are thin and watery. So in petroleum, yellowish green thick crust on the face and neck which discharge profusely. It also cures eczema with bloody cracks but little or no discharge. Eczema is dry and scaly or moist, which is disappearing in summer and reappearing in winter or cold weather. Eczema and fissures occurring on the hands or behind the ears. The discharge is thin and watery. So some rubrics with remedies. So in Murphy repertory, chapter disease, rubric is eczema. Field-mark remedies are arsenic, iode, paracetamol, calcarea, calcarea sulph, cicuta, protontic, dulcamara, graphites, hippar-sulph, MEZERIUM, oleander, petroleum, soranum, rustox, sulphur, sulphiode. And single remedies like eczema after vaccination, it is MEZERIUM. Eczema with urinary, gastric, hepatic disorder, it is lycopodium. Eczema at menstrual period or at menopause, it is mangum acidicum. Eczema at seashore or ocean voyage, excess of salt, it is a natrum mur. Eczema without itching, it is cicuta. Eczema of whole body, protontic and rustox. So thank you. Here we complete the eczema with its therapeutics. Till here, if any doubt, you can call me or message me personally. Thank you. You can leave the meeting. Thank you.